Welcome back to Sessions from the Edge. This is where we sit with moments that split life into the before and after when it comes to chronic conditions and that strange rebuilding that happens once the dust all settles. This particular season works off a simple truth that you're not broken, you're just being rebuilt. And today I'm speaking with someone who's lived in that very particular way. Dr. Keith Holden is a physician specialist in internal medicine, but that's not why he's here today. I'm talking to Keith because he's a dual titan, certified in functional health, and also suddenly found himself on the other side of the table with a prostate cancer diagnosis. But what I'd like to do now is I'd like to start this conversation somewhere small. And when I say small, I mean really small. And Keith's not aware, but I'm going to take him back into his mother's womb because, as I can gather from all the research that I've done for this session, and I see he's smiling there because he didn't know this was coming. And I never tell my guests where this is going because that leaves it open for them to just ad lib. Keith, welcome to the session from the Edge.
Okay, thank you for inviting me, Paul. I really appreciate it. So if we're going to start at my mother's womb, I'll say that I was born a twin, fraternal twins, and my twin and I were pretty cramped in utero. He was a very large twin. I was medium-sized, but the cramping in utero caused him to need to wear corrective braces. I don't know if they do that anymore, but his feet were slightly deformed, and I was born with what was called then a floppy neck. I suspect it was torticollis, but I was born where my neck just laid on my shoulder the entire time, and that was from what was going on in utero. So I'm sure that my little body and his little body were pretty stressed out and wanting to get out of there. And so that wasn't the perfect start, but here we are. And so once we were born, I was, my parents have always been very open-minded, but very balanced with their thinking with medicine. They always had a traditional doctor, but at the same time, they believed in chiropractic. So in 1964, that was a time when chiropractors were considered, blasphemy of medicine, just quacks, total quacks by the American Medical Association. And in fact, the
I'd
American
hate to say
Medical,
it's still a bit like that in Australia.
yeah, it is a bit like that now too. And sadly, one of my best friends is a chiropractor. He's a very gifted healer. And I always like to say a healer is a healer. And if
Yeah.
someone knows how to get people well, it's just, they have it. And so my start in life was my parents bringing me to the chiropractor because my pediatrician said, we don't know what to do. We can try some physical therapy. We can try laying his head on some sandbags and trying to prop him up. But other than that, they didn't have much to do to treat that. So at that point in 1964, my parents took me to our family chiropractor, and he worked with my little neck and adjusted it. And pretty soon, my neck was doing well, and I was considered healed from that condition.
Mm.
And I do remember my twin wearing braces well into his probably age 4, age 5, to correct his problem. And but
Is
the
that leg
start,
braces or the torso brace?
no, it was just leg braces to the.
Mm.
I'm pretty sure it was just to his. I can't remember. It may have been to his waist. It was definitely to his knees. And but that was my start in life,
Mm.
exposure to a chiropractor, and then my uncle was a chiropractor, and so we would line up at Thanksgiving and Christmas, and all the kids would get adjustments. And so
No turkey on the table, just kids.
yeah, yeah. So chiropractic was a norm for me growing up. And
Yeah.
at the same time, medicine ran in my family. I had a half a dozen cousins that were doctors, and my oldest brother went to med school at the same LSU School of Medicine I attended, and he became an emergency medicine physician. And I followed in his footsteps, went to LSU and graduated and went to LSU internal medicine residency, which is internal medicine here is adult medical care as a primary care physician. So age
Yeah.
18 up until whenever. And I, I, my mom was a nurse, LPN, and both my sisters, RNs, and one
Yeah.
was a nurse practitioner. So we had medicine in our family, but we also believed in holistic and alternative therapies.
Yeah, right. Now, also as part of that early stage growing up, you had braces and so on, teeth braces, and when they came off, you had stomach troubles, and that was a result of anxiety, I'm guessing, by the sound of things.
Well, it was more of a story of um, it was more of a story of what happened when I had my silver fillings removed,
Okay.
and yeah, so I had gotten into holistic medicine, and I was just excited about it because it was starting to fill in the blanks that med school and residency left out.
Mm,
And this was through the Institute for Functional Medicine, which is now a globally known uh, institute for teaching functional medicine, which looks for the root cause of conditions. They were talking about the microbiome way before it was ever mentioned in any medical
mm.
journal, and now it's all over every medical journal,
Yeah, yeah, yeah.
including being mentioned as its relationship to cancer. So they were way ahead of the game, and they used the latest science that was coming out to support their teaching. So it wasn't just making it up and hoping that it later turned out to be true. They were just leaders in the forefront. And I went to a dentist who told me, "Oh yeah, I can do it safely. We're going to put in a dental dam. We're going to have a suction going the whole time. You'll have minimal exposure to um, any mercury because they're grinding it out of your teeth. There's going to be vaporized mercury flying everywhere." And
Wow.
later I found out that was probably a half way to do it, and um, it wasn't the whole correct way. So
Wow.
within a month of having my silver fillings removed, I developed severe irritable bowel syndrome, and my gut was just distended by about looked like a 4 month pregnancy. And I just could not figure out what was going on. I tried every trick in the book. I started losing weight. Um, I couldn't figure out why I was losing weight. I'm medically trained, so your mind goes to some really crazy places. I finally went. I finally went to a gastroenterologist, and she did an upper and lower endoscopy. The path came back. No, wasn't Crohn's. It wasn't ulcerative colitis. It wasn't an inflammatory bowel. It was an aphthous colitis, and she said she'd never seen that before. So we tried some inflammatory bowel medications, and they just made it worse.
Mm.
Um, Gave me terrible abdominal pain. I wasn't regaining the weight. And at that point, I said, okay, I've tried, the traditional route. I'm a good doctor. I'm going to go do what I'm supposed to do and go see one of my colleagues. And I didn't get better. So the next thing I did, I found out there was a integrative medicine clinic in St. Augustine, about an hour south of me, and that they had a physician coming from the Paracelsus Clinic, which is a world-renowned integrative medicine clinic in Switzerland, and he was coming and giving them, you know, training. Not he wasn't practicing medicine, but he was teaching the doctors there his style of medicine, and it was like it's called European biological medicine. It's kind of like a souped up in functional medicine here in America. He did some testing and he said, "Oh yes, you're definitely mercury toxic, and you've got high levels, and we really need to attempt to chelate that mercury so we can pull it out of your body." and he gave me injections of a drug called DMPS. The first two injections seemed no big deal. By the third, I got really sick, and then a week later, I turned the corner and I started gaining weight again, and I got to feeling back to normal. So there was a lot of weird stuff going on there that a lot of American trained doctors would have no idea what I was just talking about. So I got exposed to a lot of integrative type approaches. Uh,
So, so uh, I'd just like to step back a second there because you're mentioning two things that are very deep in the way I think and operate, but it's not very common. Certainly not a common yet. I don't know about the US, but in Australia, it's reasonably unheard of, and that's this functional health and integrated health concept. Now, you're certified in functional health. What does that mean to you as a medical practitioner in terms of having a functional health approach and being certified in functional health? What is that?
I actually never completed the certification process, mainly because I got sick. Um, but I trained in it. I did 4 of their courses, and I found that it was enough that I could go and start my own practice and use a blend of internal medicine and functional medicine. And functional medicine looks for the root cause of issues. I learned a lot through them. I learned looking at the microbiome, as I said, was a integral part of functional medicine, and we used comprehensive digestive stool analyses to look at and find a lot of times parasites that traditional gastroenterologists didn't find, pancreatic insufficiency, where your pancreatic digestive enzymes aren't uh,
Mm.
being produced. And those people would be struggling with irritable bowel type symptoms. And it was really looking to treat what was going on with them specifically rather than just suppressing their symptoms with a medicine, which is what traditional medicine does for the most part.
So, traditional medicine, you've got a perspective on traditional medicine. Would you like to elaborate on that a little, because it actually speaks to how you have this holistic perspective as well?
Yeah, I'm a big fan of traditional medicine. That's
Mm.
my bread and butter. That's what I was
You're a
trained
G-
on.
you're a doctor.
Yeah, that's what I was trained on, and I totally respect it. It does have its limitations. Like I said, I learned a lot in functional medicine that filled in a lot of the blanks that med school and residency left off, and that's why a lot of times traditional medicine is treating, using the pharmaceuticals to treat the symptoms, to suppress their symptoms, rather than going and looking at root cause issues and addressing it there.
Mm.
Um, Also, functional medicine takes a really big mind body approach that I did not learn in psychiatry. I learned in psychiatry rotations that, oh, this is this symptom criteria. Well, then this is the drugs you use because they've got bipolar or major depression or anxiety disorder. And then later I found out, antidepressants like SSRIs only work in about 50% of individuals.
Mm.
And so I
But
use more I use more mind body practices in mine because of that very issue.
and 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 that's what is interesting, because even in my own book, in Decode Your Diagnosis, I suggest that allopathic medicine is just as important as all the other options on the table, but they're just one, and modern medicine is very good at intervention, but it's not good in that long-term holistic approach looking at the underlying causes, as you've just been saying. But you've mentioned something there that's really important and interesting to come from a doctor, and that is that you're talking about the mind, not from the clinical perspective of the mind, but in terms of meditation and those other areas that you talk to most doctors about, and they will just look at you like you're on another planet and stop smoking the drugs.
Well, the funny thing is that there's tons of medical science that proves mindfulness and meditation are,
Yeah.
I mean, it's been in the New England Journal of Medicine. I mean, it's out there. The doctors don't have time to teach somebody a mind-body practice, much less meditation.
Mm.
Um, they barely got, 15 minutes to take a history and do a thorough physical and then come up with a game plan. Um, you know, they and then they might refer to a psychologist. And
Mm.
I'm hoping the psychologist has some serious background in mind body medicine. It's proven to when you get down into that relaxation response, it is proven to give you a really nice epigenetic effect as far as it creates a really powerful anti-inflammatory effect, mainly through nuclear factor kappa B, which is
Mm.
a very common producer of inflammation in the body. And so it's got other activities. It can increase mitochondrial energy. It can reduce body rust and increase the ends of telomeres.
Yeah,
So
the telomeres are those sort of like finger extensions inside cells, aren't they?
yeah, and that can have an anti-aging effect. It slow down the aging process a bit, but it's important to incorporate the mind-body medicine part because stress is a component of every illness, whether it's played a role in initiating it or whether it's playing a role in sustaining it or making it and aggravating it and making it worse. So you've
Mm.
got to address the mind body with a patient if you want to be truly holistic with your practice. And if you can't do it and you don't have the time, I hope you have a someone you can refer to that's good at that because it is a integral part of treating a patient especially who has chronic illness.
It's interesting that you don't go that one little step further and talk about the soul, as in the driver, the origin of you, who you are, what makes you you, and what drives you every morning you wake up and go, wow, today I'm going to do this.
People who read my Substack know I talk about spirituality and spiritual
Yes,
practices, and
that's why I'm probing, because you mentioned it in your Substack, but you're sort of steering clear of it here in this
no, I'll be
conversation.
glad to talk about it. I have a deep, deep spiritual practice that's a lot of fun, and I have seen some amazing synchronicities, the unexplained coincidences. I had a couple of premonitions that came true, all through deep, deep meditation. And I truly know that helped my body, mind, and soul make that triune and connect, like they talk about with yoga. It's a powerful experience.
What was the thing that moved you from traditional medicine? And internal medicine is a traditional medicine. It's looking at chronic conditions and so on in adults. How did you move from that across to this functional health?
I think I was lucky in that I found the Institute for Functional Medicine and looked at their training materials and thought, wow, this is all evidence based. This is science based. Was it, was a lot of it new? Yeah, but it was still published.
Mm.
So this just hadn't made it to the New England Journal of Medicine yet. But everything was science based and evidence based. And that's why I thought, wow, this group of doctors are innovative. They're cutting edge. I'm gonna go study with them and see what I can learn. And I learned enough to where I felt comfortable leaving my internal medicine practice and starting my own integrative practice for 5 years. I did that at a time and a place. Northeast Florida is not really considered progressive. If I'd have been down in Miami, that might have been a different story. But up here in Northeast Florida, these people aren't used to paying for medical care out of pocket, and that's what you have to do when you start an integrative practice like I did using
Mm.
functional medicine approaches. Because a lot of the tests were using specialized labs that their insurance wouldn't cover, or it'd be a battle to cover it. And also, I was spending a lot of time with these patients. A new patient, it wouldn't be unusual for me to spend an hour and a half with them. And
Mm.
that's because I wanted to get to know them at a very deep level and help understand where maybe some of their um, angst was coming from that's contributing to the stressors in their life, which is in turn contributing to their chronic illness.
Mm. Let's talk about anxiety a bit, because I have this perspective that I quite possibly got prostate cancer. There's got to be some genetic connection there, although nobody in my genetic lineage has ever had prostate cancer, but I actually lost the family business. I then got diagnosed with prostate cancer. I've never done the genetic tests and so forth yet in terms of functional genomics or anything like that, but certainly stress had a big play in my general well-being. And I remember over the years I've had pneumonia a couple of times, and yes, okay, there's got to be some underlying bronchial issues there, but they get exacerbated with stress. Those things hit you. And when I go on holidays, literally after that sort of a heavy year, I then, get knocked down with pneumonia. Let's talk about chronic conditions in particular. What's the sort of the nexus there? What's the connection?
I mean, stress and anxiety go hand in hand. They contribute to each other. They're like bad friends hanging out and, corrupting each other. So they will contribute to each other. The stress response is going to it can do some good things for us. It can help our body respond to an acute infection, and that can be a very nice stress response. But if that stress response becomes prolonged, or if it's been going on in our life for years and we keep getting triggered and we keep going into that anxiety response, then eventually it lowers our immune system. The science proves that it will make your immune system as bad as somebody who started to age and their immune system starts to wane. If that
Mm,
anxiety lasts and stress lasts long enough, that's what's going to happen. I've seen and talked to so many people with cancer, prostate cancer specifically. I talk to a lot of
mm,
these guys who find my Substack, and they'll contact me by email and they want to talk about it, or we'll call each other. And so many of them have told me, I had a really, really stressful time in my life the the 2 years before I got my diagnosis, or the 3 years before I got my diagnosis. And it was a recurring theme. These genetic mutations that occur in prostate cancer and any other cancer,
yeah.
they're not an automatic mutation. You know, they they
They're
they tend to
triggered.
be triggered, and these epigenetic influences and stress. The stress response is a epigenetic influence.
And let's just briefly, in your words, define what epigenetics is, because there might be some people here who don't understand that.
Epigenetics means above the gene. So,
Mm,
the DNA is our blueprint. It's what our body uses as a blueprint for the genetic origins of our tissues and then any diseases that happen. Um, and so what happens with epigenetics is something influences how the genes express. They're not changing the genes that you have, they're influencing how your genes that are already there are expressing. They can express in a way that's going to improve your health, or they can express in a way that's going to have detrimental effects on your health. So that's what epigenetics does. And stress is as big of an epigenetic influencer as, say, smoking. I mean, granted, there's some people who've done that and never have cancer, but they don't have the same genes.
no.
So it's always that environmental epigenetic influence that changes how our genes express, and thus it can be good or bad. And that's why I encourage people to do meditation and mindfulness, because it has an epigenetic influence. It creates a
Mm.
relaxation response in our body, which then triggers genes that express that help us.
Yeah, I've got a whole chapter in my book. The chapter's titled "The Blueprint and the Brushstrokes." So that's the way I sort of think of epigenetics, and it's interesting. I've often thought about it in the negative, and I've never really thought about it on the positive side in terms of, say, meditation. What other things are positive influences? Of course, we know about fitness and diet and so on, nutrition, but if you were to sum those up, what do you think is sort of the broad topics?
Nutrition has a massive
Yeah.
epigenetic influence. these polyphenols that are in foods that are good for us, they have epigenetic influence on our genes on how they express, and it causes them to express in a positive manner that has the potential to improve our health.
Mm.
So everything in our environment pretty much is an epigenetic influencer. If you've got a man who has been in a printing press his whole life and he's got genes that are predisposing him to develop certain cancers that can be triggered by those types of toxins, then that's a detrimental epigenetic influencer.
Mm.
And he doesn't know that. He's not been
No.
doing it. That's why it's a mystery to everyone. But at the same time, you've got integrative doctors that dig deep and find that information and say, oh, okay, this could be what contributed to that.
Mm. And talking about epigenetics and back to you in terms of your cancer, when did you notice or when did you feel? Because what I found is that I didn't really feel anything with my prostate cancer diagnosis. It was just that I did, a full spectrum, a bunch of tests. Literally went to my GP and said, okay, I've gone through the ringer here. I've just turned 50, birthday time. Let's go through and have a look at everything and see if we can find anything, and then gives us the opportunity to fix it. What happened with you?
So I was 53, actually 52 when it started. I came down with severe prostatitis symptoms at 52.
Which is, for people who don't know what that is.
It's inflammation of the prostate, often caused by bacteria, which
Yeah.
create an infection, which is inflammation, and can
Mm.
be treated with antibiotics potentially. So I came down with symptoms of acute prostatitis one night, and we were leaving to go on vacation the next day, and I just had my GP call in some antibiotics, saying, "Okay, this should kick it while we're on the trip," and it didn't. In my mind, I'm thinking, "Okay, maybe it did, maybe it didn't. It probably didn't." But I came back and I saw a urologist, and he did an exam and told me your prostate's indurated, and meaning it has a regular surface, and we should consider a biopsy, but I want to try and get this prostatitis under control because it was really symptomatic. And
Mm.
the problem that my urologist was only doing transrectal biopsies; they weren't doing transperineal. So, with the
Okay.
transrectal biopsies, you get this increased chance of infection, and potentially, in theory, it could be worse if you've got an active infection going on. So, I took several rounds of antibiotics and I did seem to get better, and that kind of threw me off a bit. And then my father got sick and started dying, and I went home to Louisiana. And by the time I was done there, I knew I had to come back and get my biopsy done, and I
Mm.
did. And the amazing thing was, as soon as I had that biopsy done the next day, my prostatitis symptoms were all gone. My urologist said there's no way I can scientifically explain that. I don't know what to tell you. That's what happened. And
So what's your theory behind that then? Forget about your medical training. What do you think happened there?
I think my body was saying, you need to do something quick, and I'm going to keep your attention until you go do that.
I like that. It is interesting because your body does talk to you. Like
Yes,
physically, it
it
tells you.
does. And not many people really listen to their bodies.
No, no. It took me prostate cancer to start listening, and now I'm a big listener. But yeah, especially men, we're ignorant.
Well, men aren't into touchy-feely, and they'd rather just push through and be
No,
stoic. That's how my dad was, extremely
yeah.
stoic, man. I learned some of that from him, but in the end, we got the diagnosis. My prostatitis symptoms went away immediately, but then everything else kind of happened.
And so, talk about everything else. What happened?
Yeah, so I ended up having a Da Vinci robotic prostatectomy down in my area. I wasn't far from one of the world-renowned robotic docs. He'd done 11,000. Vipul Patel. He's very well known here. He has his own wing in the hospital. And so I saw him. I liked him. He's a go-getter type doctor, very knew what he was doing and proud of it. And I felt comfortable in his hands. And the next morning after the surgery, he said, I didn't find anything unusual. I didn't see any tissue that I didn't expect to see. And I thought, okay, great. Maybe there's hope here. And then, but when the path came back, it had already broken through the capsule and had gone into
So,
two of the 9 lymph nodes that they pulled out at surgery.
I was going to say, because when I have been following you for I've only been on Substack for about 6 months, but I've been following you for most of that time. And what intrigued me about your case is that mine had come out of the capsule, but only just. Like, so when he did the biopsy after the operation, there was just a little protrusion, and it had started tracking across the lymph nodes, but it hadn't actually got there. So everything got removed, same scenario. I did the prostatectomy as well. And a great doc in Australia at the time that was very new, new surgery. You know, he was saying, "Oh, we've got this new surgery," and that for me, that was it. Now my numbers, my PSA numbers are negligible, like 0.0008 or something. You know, like right down. Yeah, it is great. But so it did track to the lymph nodes, and it progressed for you further. Now, what's happened since then?
It's been a pretty long story since then. We're 8 years old. April will be 8 years of since the prostatectomy. I had some genomic studies done with the tissue. Not great news. My decipher was 0.81. That's high risk.
Okay, so just let's talk about your genomics test. What is that, and why is it important to you?
So the Decipher test is a very popular and highly used test in prostate cancer these days, and it tests 22 RNA. It's part of your genes. It's the
Mhm.
RNA that produces the proteins and that make things. And so it tests for those genes to know if you're going to be high risk if you have a lot of the ones that are associated with prostate cancer. And they found the ones that are associated with prostate cancer by studying literally hundreds of thousands of men in clinical trials. And they've created this massive oncology database of genes that are associated with prostate cancer and show how they increase risk. And so I had that, and then I went to MD Anderson, and they had taken my prostate tissue from my surgery and sent it to another company called Foundation One, and they were looking for mainly somatic mutations that are mutations that occur in the prostate, and they can keep occurring as you just live your life with prostate cancer. They can keep evolving and developing new mutations. But at the time I had it done, the only significant mutation they could find was called a P10 mutation. And that's, if it's not mutated, it's protecting you from developing cancer. And mine was mutated, so it was no longer protecting me from developing or progressing with cancer. So all these things play a role, and the really good prostate doctors know which ones put you at what risk, and also know which ones suggest that you should have more aggressive therapy and with what. And that's what they're using these genetic tests.
And so it's 8 years now, as you say, since you've been working with your prostate cancer and the follow-on issues. In the philosophy that I created, I have this thing called dynamic harmony. So there's no such thing as balance, right? That's a fallacy. You know, work-life balance, all those sort of things doesn't exist. But this dynamic harmony that you create between the ebbs and the flows, the positives and the negatives, and just, you know, continuing along, so you can bring yourself into a state of thriving with a condition, because you can't necessarily cure yourself. Like heart disease, I can't cure it. In your case, it sounds like you can't cure your conditions, but you can find dynamic harmony between the mind, the body, and the soul, and all the impacts, because, you know, there are forces, internal forces like stresses and anxieties and things, but then also external forces, like the environment around you or work. I would say that you're very good at balancing dynamic harmony. What does that mean for you in terms of not curing but thriving with this cancer?
Well, I'm still planning on a cure.
Oh, look,
Yeah,
me too. I'm trying to reverse heart disease. Everybody will tell you that's
and
impossible, right? But
I've talked to plenty of guys who are just, like, happy with controlling this thing.
yeah, that's right.
I'm not. I'm not. I want a cure, and that's where I'm headed, and I've seen the data of spontaneous regression of multiple types of cancers. I've seen those case studies. They are super impressive. We don't know how it happens. There's several theories, but if they can do it, so can I.
Okay, so
Um,
take your medical hat off again and think gut feel. How do you think people regress conditions?
well, it's a good question to ask it that way. How do people regress conditions? I don't know if it's a person regressing yet. I think it's a combination of, and I'm going to include spirituality in this.
Hmm. Please
I think
do.
miracles occur on this earth every single day. No one's immune to a miracle. I do think that certain people who have regressed have documented their persistence with not giving up, their changes in their lifestyle to make the tumor less favorable in their environment. And by their environment, I mean their body. Those are the ones who are eating super healthy. They're doing fasting. They're doing various things to make themselves less vulnerable to that type of cancer. I'd say most of them are using some type of mind body practice, at least positive thinking, and saying, hey, I know I can do this, and sticking with it and not giving up despite the curveballs that get thrown at them during this whole process.
Well, positive thinking is as much about the soul as anything, isn't it? It's like having a belief in yourself that you can actually beat this thing. Whether you can or not doesn't matter. It's just having that positive mindset and then doing something with it, and like you say, taking those measures. I don't drink, I don't smoke, I exercise every day, I meditate nearly every day. I start my mornings with omega-3s. So, I've got severe buildup of plaque, which at the moment is incurable, but or irreversible. But I'm either putting it on hold or trying to reverse it. Let's say, has it worked for you? Yes, you're not cured. You're not cured, but what do
Well,
you think are the things that have contributed to you?
I think I've beaten the odds because when I had such bad pathology at my surgery, I was considered locally advanced, which is I had localized lymph nodes in the pelvis that were
Hmm.
positive. It hadn't gone up into my periaortic
Yeah.
nodes yet. It had gone into my liver or bones. So I was locally advanced, which isn't horrible. That's some men would give anything to have that kind of start. The ones
Hmm.
that are diagnosed with Mets everywhere, they light up like a Christmas tree on a PET scan, and they give anything to have locally advanced. I've still beaten the odds with that fairly bad genomic study, the Decipher and the P10 mutation. And then for whatever reason, the tumor cells have never gone to bone. Incredibly rare for someone 8 years out with a PSA of 395. A normal is 0 to 4, the reference lab. They say normal, and it varies with age. And also, some men with an enlarged prostate will have more than 4 and still not have prostate cancer. Some men with have chronic prostatitis will have higher than 4, but still not have prostate cancer. So it's just a marker. But with your prostate gone, like you and I, it should be 0, unless they left some tissue behind that's still producing PSA and you don't have cancer, then it should be 0. And so then after that, it took a little while, but then the cancer showed up in a PSMA PET scan in my para-aortic lymph nodes. So those are up higher in the abdomen, but still below the diaphragm. And those are the lymph chains that run up each side of your aorta, the main artery that runs through the middle of your stomach. And
Hmm.
so it finally made it up there. And that's when we decided, hey, there's only 6 or 7 spots that's really considered oligometastatic, meaning a low number of metastases. Let's really go after that. And my radiation oncologist, who I love, came up with the idea. So we're going to paint your aortic lymph chains with proton therapy. And then we're going to boost the proton therapy at each one of those little spots that lit up, the 6 or 7 spots. So he
Mm.
painted and boosted. He did a really good job because my next PSMA PET scans all came back negative, all 3,
Yep.
despite doubling time every 9 months. And even at a
So this is
PSA of
pause there for a second. Doubling time is?
So how fast the PSA doubles. A lot of clinical trials will use the 10-month doubling time as a cutoff to treat. You should be being pretty aggressive with that person unless they're opting not to treat or they are very debilitated and can't take the therapies, in those instances. But in mine, I couldn't tolerate androgen deprivation. I tried it. It caused me to go into severe sleep deprivation due to the hot flashes and the night sweats, which mainly occurred for me at night. And I developed severe depression and I wanted to check out of here. So I'd never in my life had wanted to give up anything. And that caused me to want to give up. And I said, okay, I can't take a medicine that's going to make me want to give up. I need to try some other way. And so that's why we went with the radiation and weren't being aggressive with the androgen deprivation after the 2 attempts.
Are you treating yourself as not a patient, but as a test subject in a way? Or like you're approaching this not just as a physician in terms of functional health physician, but you seem to be also doing what titans that have a condition do is, test things in your own manner and in your own way. And we're not as well educated as you in this particular instance. I'm an engineer, so I don't know much about medicine, but I've been bouncing around the medical fraternity forever trying to figure out how to beat heart disease. And I know plenty of people with chronic conditions who do. Is that the approach that you've taken?
Yes, and I'm doing that in conjunction with my radiation oncologist that I really like, I really love. I love their team, I love their office. I've had 2 sets of radiation with them. My first set was the radiation to the pelvis after the surgery just because the PSA was rising, even though a PET scan was negative. They're like, we just need to treat this standard of care. We need to go after the area where we think the micrometastases are. They're going to be most likely in your pelvis. So we went after those. It did drop my PSA significantly, but then it continued a steady rise after that. And then we eventually ended up with the proton therapy. 3 PET scans after that, all negative despite a rising PSA. So I'm kind of a weird enigma in that I've got PSA of 300 and a negative PSMA PET scan. And my radiation oncologist can't really figure it out other than say, well, everything's just diffusely micrometastases. Okay, maybe so. But when we use these high def CT scans and do a head to mid thigh, there's no mass, there's no bone lesion, there's no enlarged lymph nodes, there's nothing that looks suspicious. This is not there. Okay, my labs are normal. The alkaline phosphatase, which is a liver enzyme, but also used to measure bone activity, is always low normal. So it's like, okay, well, if it's hiding out in the bone marrow, I would think my ALP would bump, or at least my bone marrow would be affected and my red cells and white cells would be dropping or platelets would be dropping. None of that's happening. None of it. They don't really understand what's going on. And like you said, what you described is called N of 1. One test. You're the subject and it's the N of 1 test, N of 1 study.
Yep.
But in this instances, I'm trying multiple things at once because I'm doing so much self-care.
With that self-care, what sort of regime we haven't talked about your regime so much at all, really. How do you approach it all, other than just the tests and so forth? What's the daily life of Keith Holden?
Well, I'm going to be honest in that I'm a physician, so I have some money to spend, and I'm not super wealthy, but I've made some money, and I have a lot of money to spend on self-care, and I know some people don't. So what I may say, they may say I can't do that, but I mean, if you can, here's what you should consider. You got to find what resonates with you, and by that I mean what makes you feel good what lowers your stress response and what increases your relaxation response. And I find that acupuncture once every 1 to 3 months, a massage. I was getting that about once a month. I'm now getting a massage once a week because I go into a zone when I get a massage. I am relaxed and I have the best night's sleep. So I'm doing acupuncture, massage. I'm juicing 3 times a week, organic greens with low sugar. I really am loading my body with polyphenols to try and support its function. And I'm also eating this detoxification pudding that the Institute for Functional Medicine made. And I know a lot of doctors laugh at the term detoxification. They don't believe in it. It's proven that the liver detoxifies the body through all these different enzymes, but they don't believe in detoxification outside of that. I don't care.
Why?
I do. They just don't.
Why
Even though
not? I mean, it makes a lot of sense.
it's because they weren't trained on it. It might as well not exist because if they weren't trained on it, it's not important enough to be trained on it. It's a very arrogant attitude.
It is.
It's also, you're also embarrassed if another doctor knows something that you don't that's effective. It's a little embarrassing.
I don't want to turn this into an AI discussion, but do you think AI will improve that and remove some of that arrogance?
Yeah, because AI is going to show that a lot of the techniques and approaches that functional medicine takes are actually proven in the science. Are they all proven in a reproducible manner? No, but they are proven. And Cleveland Clinic, which is one of our premier hospital systems in the United States, has taken up functional medicine and has its own functional medicine clinic. It impressed Cleveland Clinic enough to take it on. And some people will say, oh, that was just a money-making scam to get them in there and give people acupuncture and make them pay extra for it. No, they're really doing true functional medicine there. They're documenting their outcomes, and I'm hoping that they're going to publish that information soon.
I'm really pleased to hear you use acupuncture in amongst there. I mean, ultimately, if we think about it, acupuncture goes back to TCM days. I mean, so we're talking thousands of years of medical practice with traditional Chinese medicine as we know it in the West. There's a question that's just come in here from Daniel Flora. Dr. Holden, can you discuss your thoughts on joining a clinical trial? Use your N=1 to help others as well.
Yeah, I think men who are struggling with their advanced prostate cancer and they're really not coming up with answers from the doctors that they see that feel like they're going to be helpful to them as far as maybe they've already tried a couple of the medicines and the PSA is continuing to rise. Those men should definitely consider a clinical trial. That's why I repeatedly encourage in my Substack that men with advanced prostate cancer should consider getting a second or third opinion at a prostate cancer center of excellence like MD Anderson, the one I went to in Houston. They're all over the country, actually. And I find, my experience with MD Anderson, with the clinical oncologist I had, he was super impressive. He gave me an idea about segueing back into androgen deprivation that no other doctor had even come close to. And I think there are a lot of those doctors that are attracted to those types of centers, not only because of not fame and fortune, but the types of research that they do in the clinic, and that they're probably interested in doing clinical trials, and they can participate in those at those centers. So yes, I'm a big fan of advocating for clinical trials.
Thanks for that, Danielle. Earlier, you talked about the issue of people coming to you and saying, well, that's great that you've got the money to spend on your health. Things like clinical trials, they're usually free in Australia. I don't know about the US, but you can join a clinical trial for nothing because they need subjects to work with. What other things like clinical trials are cost-effective ways to manage not just the medical side, but also things like meditation, like yoga and so on? Where could you save some money but still achieve, a fair bit of the functional health objective?
Well, there are a lot of insurance plans in the U.S. that pay for acupuncture, chiropractor, physical therapy, and gym memberships, which those gyms may include classes in yoga and meditation. So I think that's a first thing to ask: does my insurance plan pay for some of those visits?
Mm.
And I've seen a lot that do.
Oh, that's interesting because it's the reverse here. Um, I've got top private health cover, and in Australia, it's not so important or necessary to have health insurance, other than if you want your own practitioners and choose where you're going to have treatments done and so on. But in Australia, they don't pay for acupuncture, but they will pay for a naturopath or a nutritionist more than anything. So typically, our naturopaths here will be a certified nutritionist, because nutrition comes in under the program, the health program, whereas say a naturopath doesn't. So it's all a bit whacked, if you ask me. But
So, forgive my ignorance, but Australia is a mixture of socialized medicine and private.
yes,
Like,
correct.
so yeah, and U.S. is not socialized medicine, and therefore it's been consumer driven to
Mm.
integrate some of those programs into health plans.
Yeah, we need a bit more of that consumer driven approach here, I think.
Mhm.
What became possible after your diagnosis and while you've been doing this that wasn't possible before in life, in practice, whatever?
Oh, the biggest thing that changed was my compassion for my patients really went through the roof.
Ah,
Because I literally had suffered a lot in this process. I had complications from several things. I had complications from the surgery. I had complications from the radiation. To this day, I have complications from the radiation. To this day, I have complications from the surgery. Every time a PSA comes around, I have PSA anxiety. Sometimes it's mild, sometimes it's not. My PSA doubling time has slowed from 9 months to 55 months. So
really?
that's not a coincidence.
No.
And I don't, especially over a 10-month time frame, that's not really explainable, and especially when my PSA went up, almost 170 points over that time frame. So,
Mm.
but going back to your question, the compassion for my patients went through the roof, which is I'm so thankful for that. Empathic care is so much more effective care, I find. And in addition, a lot of things people worry about, all this craziness with politics and everything, just don't have the time for it. I don't. I do not. Got to do my self care. I don't watch the news. I've got to
No, I don't
focus
either.
on me and getting me well. And so I've gotten out of the drama of all that, and it's so nice.
You just don't have time for that sort of thing, do you?
Yeah, having a serious health condition really it doesn't change everybody's perspective. The ones it does in a positive way, it can be really, really beneficial.
So, one question I like to ask all my guests in one shape or form is, if someone's standing on the edge of a new diagnosis and they're right at that point where that floor drops away, what would you say to them?
The first thing is to remember to breathe. Your
That's perfect answer. Yeah, keep going.
your your breath will ground you and bring you back to center if you let it. Especially if you do some deep diaphragmatic breathing, that will help trigger your relaxation response, when then starts to help balance your autonomic nervous system. I do.
Okay, let's go.
I
What's before you continue? What's phragmatic breathing?
diaphragmatic breathing, where say you're
What's that?
laying on your back and you put your hand over your belly button and you take a very deep breath, so deep that your stomach pokes out, like pooches out, and raises your hand up in the air. That's a diaphragmatic breath. You're breathing so deep, you're pressing your diaphragm down and causing your abdomen to elevate. That type of very deep breath has been proven in the medical literature to help trigger your relaxation response. And that
So
in
we're using
turn
yoga a lot.
will help bring your sympathetic stress, fight or flight down, and increase your parasympathetic rest and digest tone. Y'all gotta always remember to breathe. I tell people, watch when you're stressing out, you're holding your breath. It's very common. Not holding
And
their
so,
breath where they can't breathe, but they're very shallow breathing.
yeah, yeah. And so
And
after that
after
diaphragmatic
that,
breath, then what?
you rely on your loved ones, the ones that are, are going to support you.
Mm.
I'm so thankful I have the most wonderful husband who would do anything for me and has helped carry me through this from day one. I have a devoted older sister that loves me like I'm her own child. And I don't know what I would do without them. They have been such uh, empowered me to keep going through all this and push through. And then the other thing that's very important for me, at least, is nature.
Uh,
If you're having a bad day and you go take a walk in the woods, it will shift everything. At least it does for me. And then my hobby is photography, so I bring my camera. I start taking pictures, and next thing you know, I'm all thinking about how I'm going to edit that when I get home, and I'm going to get a different angle, and distracting yourself in a way that's going to bring you back to you is a very
mm.
powerful way to pull yourself out of that
That
scary
is
place.
super important. That's the soulful stuff happening there. That you're getting down into your essence of what really floats your boat. Going out and doing
Yeah.
photography, getting out in nature. The whole green space thing is a very good tonic. When you talked back then, when I had to smile internally when you spoke about your support network, because I've got a whole chapter devoted to that in the book as well, where it's just critical. It's just, I don't think I'd be alive if I didn't have my wife there supporting me and so on, just like you with your husband, and that extended network of people and those, and it's not just your medical team, but it is your yoga studio team. It is your meditation team. It is your sports physiologist or whatever, your gym, your nutritionist, your naturopath, your TCM practitioner, whatever your combination is and whatever you
Yeah.
make it, they're
Yeah.
all important. They're all super important.
Even my clinic team. I go,
Yeah.
I've been there 10 years and I feel like they're my family and they
Yeah.
always checking on me, always want to know how I'm doing. I don't really talk to them much outside of work, but when I'm there, they're my family and they're also very
Yeah, yeah.
beneficial.
And that is the critical part of it, is that you become the champion. So if you have a positive network around you in terms of the conversations you have, in terms of going, one of my other guests, Patty Wallen, is works with people about going to medical appointments and preparing for them. And so, when I go to an appointment, I've got the objectives that I want to achieve while I'm there in terms of, the outcome of the consult. And so you're going in there with preparation, with enthusiasm, and that lifts the whole team, doesn't it? It lifts your medical team. And that's the critical important part, is that you become the champion of your own destiny, basically, doesn't it?
Yeah. I mean, it can backfire on you if you bring too much AI
Yes.
and internet information in there, and then your
No,
doctor's
no,
going to talk you off the ledge because half of it's not true. But But yeah, haven't especially if you have someone in your life that's, got a medical background, it can be
Mm.
so incredibly beneficial to have them help you prep for your doctor's visit or even come
Mm.
with you.
Well, Keith, this has been fantastic. Before we go, I'll open it up to the floor. Is there anybody have any questions they'd like to ask Keith while we're here? Great interview with wisdom and hope from John. I'll take that as a statement. Thank you, John. That's really positive, and that's what we try and do. I mean, as people with chronic conditions, we've got a lot of scars and a lot of learned messages to share with people. We're not here to find some new cure for any condition, but we're here to just share our experiences, and hopefully the next person that gets diagnosed with something, because diagnosis of a chronic condition is one of the most earth-shattering things you can have in life. That and a death of a loved one. Some people might say losing a business and things. Yeah, that's tough, but it's nowhere near as tough as being diagnosed. There's life before that and life after that, and there's no two. You can't go back. There's no turning back.
Yeah.
So that's what we try and do here. Thank you, Dr. Holden, for sharing your experience on both sides as patient and provider. That's from Patty Wallen, who's the person I was talking about, who I interviewed last week. I just love having this conversation. It was a real privilege, and I appreciate it. Thank you very much, Keith.
Well, I appreciate everybody who joined us, and sincerely appreciate you asking me to do this, Paul. Thank you very much.
We'll talk again, Keith, sometime.
Okay.
Thank you, everybody, and we'll see you all again soon.